I'm Leslie Gillum, and today I'm going to talk about screening mammograms. You will never hear a woman over 40 say that they love and look forward to annual screening mammograms. However, this test is very simple and can truly be a lifesaver. Today I want to discuss the importance of having mammograms annually versus biannually, preparations prior to the test, as well as the ease of the exam, the care model for breast health, and showing images of what a skipped year or two may result in. Annual mammography is an important part of the continuum of care for women. This test has the capability of finding very small curable cancers if performed annually. Screening mammography should begin at age 40 and be conducted annually, based on an article in 2019 by Sanjay Puthi, MD, titled, "With Differing Guidelines, I'm Not Sure When to Begin Screening Mammography. What does Mayo Clinic recommend? Annually is the best option and should be discussed with the woman's provider. Determination of time and variance can be discussed, and based on the following risk factors, which could be family history, benefits and limitations of screening mammogram, which could be dense fibroglandular tissue, a timeline may be determined with the woman and her provider." Conflicting information about annual screening was presented to the U.S. Presented Task Force in January of 2016. They recommended that women start having screening mammograms biannually at age 50 and continue to 75. Governing bodies such as the American College of Radiology and Susan G. Komen Foundation, as well as facilities such as Mayo Clinic, did not agree with this recommendation and held true to the annual screening mammogram. Now I have discussed purpose and recommendation pertaining to the frequency of the exam. Let me move on to my next point, which is what is involved in the exam. Based on information from the American Cancer Society in 2019, refrain from having the exam the week before menstruation. Breasts tend to be tender the week before, and avoiding this exam could reduce discomfort. Also, refrain from wearing deodorant to your mammogram appointment because deodorant may mimic a certain type of breast cancer. The actual mammogram consists of two images of each breast. First, the medial lateral oblique is an angled side-to-side image of the breast as demonstrated in the picture. Next is the craniocaudate view. This image of the breast is taken from top to bottom. Now that I have discussed the importance frequency of the exam and the actual exam consists of, let me move on to the next point, which is the importance of having the exam annually. The care model for women is like a triangle. It consists of monthly self-exam, annual clinical exam by a physician, and an annual mammogram. Annual screenings can detect cancers as small as 1 millimeter. When not performed annually, cancers like the one in this image may become large tumors. For a more realistic picture of what you may see, this is what annual screening mammography can detect versus this is what may be found years later if annual screening mammogram is not obtained. In conclusion, annual screening mammograms are a very important tool to diagnose breast cancer. Important exams such as having this annually to detect at an early stage is a very important part of the women's continuum of breast care. It is an easy exam and should not be delayed, and as I have mentioned, it is the best way to find cancers earlier. In closing, the phrase, "women will never agree with loving their mammograms," is actually one phrase that can save their life.